This is Where We Live from Connecticut Public Radio. I'm Catherine Shen. Today marks 5 years since COVID-19 was declared a global pandemic. All week, Where We Live is marking the anniversary, from reflections working on the front lines to the lessons learned in public health. But today, we're talking about how we remember the COVID-19 pandemic and memorialize the lives we lost. More than 1 million people have died of COVID-19 in the United States. So to put that into perspective, that's more than twice the number of Americans that died in World War II and nearly 20 times more than the number that died in Vietnam. Kristen Urquiza understands the loss intimately. In 2020, she lost her father to COVID-19. Today, she's the co-founder of Marked by COVID, a survivor-led organization working to establish a permanent national COVID memorial. Good morning, Kristen.
Good morning.
Well, thank you so much for joining us. And for our listeners, let us know if you have a story you'd like to share with us. How do you want your loved ones to be remembered if you've lost someone to COVID-19? Let us know. 888-720-9677 or find us on Facebook and Twitter at Where We Live. So, Kristen, before we get into this project to create a COVID memorial, want to hear your story. Can you tell us about your dad?
Yeah, I'd love to. My dad's name was Mark Urquiza, and he was a healthy 65-year-old who got sick with COVID in June of 2020. And just to sort of bring us all back in time, that was a time where we didn't have much in the ways of medical treatment for COVID. We definitely didn't have vaccines. States were still scrambling to get masks to their healthcare workers and enough ventilators for hospitals. And this was, particularly acute in sort of low-income communities and communities of color. And the state of Arizona, where my dad lived, was really, really quick to open up. And our governor, went on a PR spree saying, "We're on the other side of this." In May of 2020, get back out there, take a loved one to dinner. And that message made it to my father, who said, why am I still masking? Why am I still staying at home if the governor says it's safe? And that's what led him to make decisions that ultimately cost him his life.
And so all of today, we're going to be talking about our memories of the pandemic and thinking about this was 5 years ago. So now we're here 5 years later. Sometimes it can be hard to remember where we are or where we were at the time. Could you paint a picture of what was happening when your dad died? What did June 2020 look like for you?
For me, it was a bizarre place. And, I was living in California, working remotely for an environmental nonprofit that I'd worked for a number of years. And, I ultimately actually, felt, terrified of sort of what was happening around me. I actually relatively felt safe. I had a remote work job. I was, I'm not impacted, in the way that many people had already been impacted. I wasn't in the healthcare industry, but I was also very worried about my parents, who lived in a very different state with very, very different rules, and being on sort of the cusp of what folks were saying were the, most vulnerable individuals. But I was getting my groceries delivered. I was, masking everywhere I went, whether inside or outside. I wasn't going many places, mostly walking my dog, with a mask on in my park, because I didn't want to, get sick with COVID. And I definitely didn't want to get sick and potentially pass it on to somebody else. So I was on team, like, let's flatten the curve so that our healthcare workers can do everything that they can do to take care of, the patients that are coming into their doors. And I was really in that sort of, disaster mode of, there's a crisis hitting our door right now. And the most important thing that I can do to not be a pressure on the system is to take care of myself and my family and try to keep them safe.
And was that something that you were seeing around you? Were other people doing the same things?
Yeah, no, it's a great question. I live in San Francisco, and folks were, going to extreme measures to really sort of practice social distancing and masking. And, the roads were really really empty because people were staying at home. There was a lot of telecommuting happening here. Also, people kind of, exiting the city. And so it was an all hands on deck measure here. And as a result, if when you look at the data, the San Francisco Bay Area had some of the lowest rates of transmission, long COVID, and death as a result of the behaviors that people took, but then also the policies that were implemented. We had a no eviction policy for many years to help folks that were experiencing loss of income. There was additional, resources for food banks to make sure people had food on the table. It was in some ways, an actually really beautiful time of both the community as well as the local government kind of putting people's lives, in the forefront to ensure that we could sort of navigate this really dynamic and bizarre and strange and terrifying existence.
Well, and it's interesting because the two scenarios that you just painted for us are both very different. And so your dad was in a space that was not the space that you were familiar with when that was all happening. So when you first found out that your dad was sick, what went through your mind?
I remember the very first thing that went through my mind was we have to get him a test. So again, this was at the time when you needed to test positive for COVID in order to be able to get treatment for COVID. And, my dad's initial reaction was, those are really expensive. Like, how am I going to afford that? And I was like, it doesn't matter. Like, I will pay for it. Like, put me on the phone with whomever. I will make sure that you get a test. And I just went into, oldest daughter, like, we're going to fix it mode. And I have to make sure that my parents are isolated from one another. I have to make sure that they have food. I have to make sure nobody, we need to figure out who you've talked to in the last 2 to 3 days to let them know that you're not feeling well. I just was really sort of implementing this, like, we need to do everything we can to get you the care that you need and then also protect others around you. But while that was happening, I also felt this incredible hole starting to form into my stomach where I was like, this could be really bad. And that was terrifying.
Well, I think a lot of people, unfortunately, that would really resonate with, I think, many, many listeners who have had that same feeling. And the word scary was described multiple times during a conversation this week as we sort of mark this anniversary. And we're at that 5-year mark. How do people react when you share that your dad had died from COVID?
I've gotten all sorts of responses. I will say when I talk to people face to face or sort of in, settings where people opt in to kind of hear that I'm working on COVID, folks are by and large incredibly, kind and apologetic and curious. But that doesn't always exist on kind of online spaces. One of the things that many folks will, share and that I've experienced myself is this horrific questioning of sort of how your loved one died or why they died. It's a litany of questions like, well, were they vaccinated? Or, did they have a pre-existing condition? Oh, I saw a picture of your dad. He looks like he was overweight. That's why he died. Just sort of kind of picking any excuse to sort of just explain it away versus what you would find in any other situation where you run across somebody who's bereaved, where they'd say, oh my gosh, I'm so sorry for your loss. Luckily, those types of interactions don't, at least for me, haven't occurred face to face. But, for a long time there, we were all isolated. I continued to practice social distancing and remote work and all of these things for a number of years. And so, I was definitely targeted for this, terrible type of questioning that just made the loss that much more worse because it was trying to downplay how big of a deal it actually was.
Well, and I think with every death and the grieving process, of course, is so different. But with this, with the added nuances of all of the experiences that you just mentioned and shared with us, how does that inform your future in terms of what does it mean for your memory, your own memory, and your dad's legacy?
Yeah. I mean, the other things too, it's like, I didn't get to say goodbye. He was alone in the hospital when he died. When he went into the ICU, I wasn't contacted for 10 hours until the doctor was able to find my phone number. So there's just so many additional traumas on top of the loss. It's a very foreign type of loss. And so when I think about, how I lost my dad for a number of years, it felt very much like he had disappeared.
Mm.
And I also felt like I had been through a war that everyone else sort of knew was going on, but nobody else, unless they had lost a loved one, had fought. And so when I look back at my dad and kind of think about the work that I'm doing now, part of establishing a public memory, brick and mortar memorial in Washington, D.C., this is all about ensuring that his legacy is enshrined in this national story, but also more importantly, that the lessons learned from COVID are codified and that we walk away from this experience with at least one truth, that this was a really big deal in which over 1 million people died. Millions of people continue to suffer from ongoing health consequences and long COVID. And we continue to struggle in a whole myriad of different ways. And I don't think that unless we allow ourselves to write that in stone, will we ever fully grapple with what happened. And it will feel as if my father's death, as well as I think many others, will feel as if their deaths will be in vain.
Well, and with everything that you just shared here too, there's so much vulnerability and there's so many consequences that I think we've been witnessing throughout the pandemic and witnessing during the present time. And as we talked about earlier, that grief and loss is already such a complicated thing, such a complicated process, and so challenging during, quote, quote, normal circumstances. How has the COVID-19, or when people are denying or questioning your own experience, how has that impacted your own grieving process?
Yeah. I mean, we don't, as you said, we don't do well with grief and loss in this country in particular. But that's, I don't think, true in other places. And it's definitely not true when you think about sort of indigenous peoples who have all sorts of different customs, kind of mark different stages of life. Loss is universal. It's unfortunate. None of us are getting out of here alive. And so I think that it is something that we need to reckon with. However, in the context of COVID, it has been just this, I think the denial of how bad it was really stands in a, sharp contrast to, people's willingness and society's willingness, but also policymakers' willingness to sort of admit how bad it was. And for me, that kind of deposited a pit of rage in my body, in which I knew that the more that we would deny, downplay what was happening, that just meant more people would have to go through what I went through and more preventable deaths would happen. And that just wasn't an option for me. And so my entire grieving process has really been framed by the fact that I have every single day been, for the last 5 years, been showing up in the town square, exposing the most horrific thing that's happened to me in hopes that it can help somebody else not go through what I've went through. And as a result, it's prolonged my grief in many ways. It's complicated it, but also at the same time, connecting with others who've lost loved ones who know this particular pain, and also seeing change happen has helped me be in a place where I now feel as if I am a much higher functioning not okay.
Well, that's certainly something to sharpie in that version of being not okay. But thank you so much for sharing that with us. I know how difficult it is to be so vulnerable, but so important for people to hear that. And thanks for helping us understand your grieving process, as I imagine a lot of people are still going through or have gone through. So I want to get into the concept of your the memorial that you're creating in a second, but I do want to take a moment to grab a call from Jack, who's calling from Middletown. Jack, you're on the air. Or Jack is not on the air, actually. I'm going to share what he shared with us really quickly here. Jack, thanks for writing in. So Jack from Middletown says that he's a healthcare worker and takes care of teenagers for a living. Early on in the pandemic, a kid lost his stepmother to COVID. Her only symptoms were coughing the day before. She was only 31 years old. It was a very tragic loss and really stunned all of us. Thank you so much, Jack, for sharing that experience with us. Certainly something that we've been hearing a lot, and especially at the start of the pandemic. And listeners, let us know if you would like to share your story. Give us a call, 888-720-9677, or find us on Facebook and Twitter at Where We Live. So getting back to the memorial here, Kristen, where did the concept or the idea of that come from?
We had been thinking about how are we going to memorialize this effort, really from the very beginning in the summer of 2020. We knew that, we would be fighting revisionist history, and that, in order to really sort of put a line in the sand that this was real, this was big, that we would need to sort of have a memorial on the scale, such as, a world war. And oftentimes I've thought, how would my experience have been different if the 1918 flu was more than just one line in my history book? So all of that kind of thinking came into, we need a memorial, we need a monument. But I also live in San Francisco. The National AIDS Memorial is here. The AIDS quilt is here. I'm part of the Rainbow family. I, have been very much aware about the impact that has had on that community, and the sort of impact that has had for folks to grieve, and also for us to continue to push forward the HIV/AIDS solutions needed. And then our community, every single person that we've talked to wanting who's lost a loved one has asked, what are we doing to mark this? And it just has been a very clear demand for both a national monument in Washington, D.C., as well as a COVID Memorial Day, which we observe on the first Monday of March in our community. So those kind of three factors made it really clear that we needed to figure out how to memorialize this event, and memorialize it at the scale where every single person is remembered, because that was very important to the community members. But also because of this is an ongoing issue. COVID is now the number 4 leading cause of death. We need to be able to continue to make space for more folks to be remembered.
Well, I think you raise a really good point here, too, in terms of the amount of people that have died over COVID, which is more than 1 million people here in the United States. And that's an enormous number of people to sort of capture and memorialize. So what do you think this memorial will look like, especially trying to capture that enormous loss and also the challenges of something that we experienced so globally?
Yeah. So we knew that this was going to be an issue from the get-go, given the sheer scale. And so we knew that we had to kind of move past traditional, just brick and mortar types of monuments. So the concept that we came up for, the National COVID Memorial, exists in 2 places, both in real life with sort of what you would expect, but also with an augmented reality layer that allows visitors to add in a remembrance of their loved one, which creates a individual sort of, small obituary for the person with their name, a picture, their dates, something about them, to allow more and more people to participate, for more stories to be told, but then also for, individuals who are just coming upon the space who may not have had the same experience, to be able to engage not only with individuals, but engage we're using technology, which has been very important to our community because so many of us had to use technology to say goodbye to our loved ones. So it opens up another kind of layer and dynamic of what this unique experience was like.
Joining us today is Kristen Urquiza, who's the co-founder of Marked by COVID, a survivor-led organization working to establish a permanent national COVID memorial, and she'll be staying with us after the break. Today, we're talking about how we remember COVID-19, and we want to hear from you and your memories of the pandemic. Give us a call, 888-720-9677, or find us on Facebook and Twitter at Where We Live. So we've been asking our colleagues here at Connecticut Public, too, to share their pandemic memories with us. Audacious producer Jessica Severin shared some of her pandemic poetry with us, and here's one poem she wrote in April 2020.
Things we learned during quarantine. That the birds in the front yard sing louder than those in the backyard. That the new towels aren't as absorbent as the ones we took from Grandma's untouched stash when we emptied her house. That our tea kettle is more essential than we thought. That sometimes tears need to run for no reason or for all the reasons. That healing words can come from unexpected places.
This is Where We Live from Connecticut Public Radio. I'm Catherine Shen. All week, Where We Live is marking 5 years since COVID-19 was declared a global pandemic. This hour, we're talking about COVID and memory. What do you remember from the pandemic? The isolation, the fear, the loss? Joining us now is Sarah Willen, who's the co-founder of the Pandemic Journaling Project. Sarah, welcome back to Where We Live.
Thanks so much for having me.
And still with us is Kristen Urquiza, who's the co-founder of Marked by COVID, which is a survivor-led organization working to establish a permanent national COVID memorial. Sarah, you've been following along the conversation. Can you respond to what we heard from Kristen so far? Anything that jumped out to you?
Sure. Yes. So it's, the first thing I want to say is just how much I admire the work that Kristen and her colleagues are doing to make a space in our minds and in our society and in our public discourse to remember every person who was lost to COVID. It's an extraordinary amount of work and an extraordinary amount of care that I can see that she and her organization are putting into this effort. So I think there are a number of things that you've been saying, Kristen, that are really hitting me. So I'm an anthropologist. I'm a professor of anthropology at the University of Connecticut. And anthropologists think a lot about memory, and we think about rituals. And so in the Pandemic Journaling Project, which my colleagues and I created, I created this online journaling platform for people to take a couple minutes each week to chronicle the impact of COVID in their lives. We started in May 2020 and ran as a weekly platform until May 2022. And this is work that I did together with my wonderful colleague, Catherine Mason at Brown University, our postdoc Heather Wirtz, now at the University of Southern California, and others. So what we wanted to do is give people a space where they could sort of track how the pandemic was affecting them. And we heard from more than 1,800 people around the world, mostly in North America, but from 55 countries. And everyone had a different story to put down, a different story to record. We heard funny things. We heard devastating things. We heard about people's boring everyday lives. We heard about milestones. We heard about milestones missed. And we heard a lot about grief and a lot about mourning, a lot about fear and uncertainty. But in particular, again, bringing in my anthropology mindset, when I listen to you, Kristen, I hear you talking about the ways in which those structures of ritual and mourning that we usually have in place, and they vary. People from different cultural backgrounds mourn and grieve in different ways, whether it's through particular religious ceremonies or particular kinds of funeral practices or particular ways of managing the bodies of those we've lost. We, in different cultures around the world, have expectations for what's going to happen when we lose someone. And what COVID took away from us in those moments of loss was the opportunity to lean into those structures that give meaning, those structures that help us find each other and support each other and connect with each other. And and those rituals and ceremonies and processes and customs that help us structure our feelings, that help us find a way to make sense of what's happening and then find a path forward. And so as I listen to you talk about, how poorly we do with grief in this country in general, and then what your experience was, Kristen, I'm sort of hearing how among the many, many different things that we've lost during the pandemic, we really, you talked about how it felt almost like your father had disappeared, how incredibly devastating that is. And yet so many of us can understand exactly what you're talking about and exactly what that means.
Kristen, I didn't know if you want to respond to what Sarah just said here.
No, I appreciate you, Sarah. Such, wonderful to be with you in this space and sort of thinking about this from a ritual perspective is exactly right. My dad was Catholic and he didn't have last rites before he died. We couldn't find a chaplain. And well, that's, not what wasn't necessarily important to me because I'm not, but it was important to me because it was important to him. And so, that was just one of just numerous things that were ripped away from so many families, myself included, that kind of just left us, not only isolated, but also confused. And this was also so sudden. Like my grandparents lived to be into their 90s. Did not think he was old by any stretch of the imagination. The caller that called in who talked about the 31-year-old woman who passed away and left behind a small child, had just a cough the day before. That we hear these stories all the time. And how do you process that loss if it's so sudden and you're unable to sort of experience it in the way that you typically do? And so it definitely resonates. These sort of ritual pieces are a really important part of how we manage our mortality.
Well, and Sarah, I wanna jump in here because so many things is running through my brain right now, listening to both of you share your stories. I want to ask about your end goal with the journaling project, because as you're describing it and as I'm listening to Kristen's story as well, is I know a lot of people went to past literature from past authors who have written diaries or written stories about the plague. And I'm curious to hear the end, sort of not the end goal per se, but the sort of the goal of the journaling project, because it feels like something that we are processing what's happening right now together in the present day. And as the years go by, we look back on it. It serves as a looking back kind of reflection, sort of an experience, much like when we turn to past literature during the lockdown, for example. So what are your thoughts in terms of the ultimate goal of this journaling project, Sarah?
Sure. I mean, I think you're really spot on. We really had a couple of goals, and I'll start by saying, when I heard that I'd have the opportunity to speak today on the show together with Kristen, my first thought was, we need to remember and memorialize those we've lost, the people, lives. That's what's should be of our number one concern. But, and this is where the work that Kate and I have done comes in. It really is also important to remember the impact of this incredibly devastating event on our society. And I think the importance of being able to gain clarity on what we experienced is only growing. So we created the Pandemic Journaling Project really with three goals in mind. One was just to create a space, an online space where people could reflect and take a few minutes each day to think, with a little bit of distance on how the pandemic was affecting their lives. We defined journaling very broadly. So you didn't have to write. People could write. They could just talk into their phone and upload an audio file. They could upload a photograph. So we wanted journaling to be defined as expansively as possible and in a way that was as accessible as possible. So no computer needed. You could just do it all on your phone. So to give people a space to reflect, that was the number one goal. A second related goal, and this wasn't a promise, it was sort of an aspiration, came from the recognition that journaling can, for some people, have therapeutic benefit. It can be good for people's mental health. And so again, we didn't promise anybody that this would necessarily be helpful for their mental health, but we knew that for some it could. So that was a second goal. And then the third goal is really with our researcher hats on. Mm-hmm. What we wanted to do was to pre-design an archive. So we wanted to ask ourselves, really the questions that you're asking, Catherine. What will researchers in the future, in 20 years, in 50 years, in 100 years, want to know about what life was like, everyday life for everyday people during this period of profound disruption? And here, there's a sentence you said, Kristen, that really sticks with me. You asked, how would things be different if the 1918 pandemic had that been more than one sentence in the history book, mm-hmm. right? What if we knew the people? What if we knew the lives? Yep. What if we knew what it felt like to not know who to trust or not know where to get good information? What would we do differently if we knew that leaders in that period had been giving confusing signals about how to protect yourself and your families? So we really designed this project so that looking backward, we'd be able to see what people were doing and saying and experiencing in order to have a deeper and more robust understanding so that, perhaps we could make better decisions. Now, 5 years out, whether we have those kinds of insights, whether they're driving policy decisions, whether we've absorbed them, that's another question.
Well, we got an email from a listener, Jennifer, who shared with us that I fully agree with what so many shared, that we brush aside and failed to address and learn from the collective trauma we as a society experience in the rush to get back to normal. And we failed to honor and celebrate those who died and those who served during this incredibly difficult time. Thank you so much, Jennifer, for sharing that comment with us. Kristen and actually Sarah as well, I think can both jump in with Jennifer's sentiments because I think she touches on everything that we've been talking about. Just respond to what Jennifer has to say and perhaps touch on, do you see the COVID memorial as a way for us to capture all of our memories during this time?
Oh, great question, Catherine. That's always been our sort of main goal, was not for this to be about the people we lost, but also be a space where people can come together and share their own experience and have that held, have that listened to, have that appreciated, because I think the work that Sarah is doing is incredibly important. We need to know the nuance of how this pandemic impacted us, not only for COVID, but for future disasters. And, it's not going to be an if we have a different pandemic at some point in the future, it's a when. And I think these lessons not only impact public health, but thinking about in the aftermath of fires and hurricanes, these types of disasters that we continue to see happening, how we respond and how we remember is incredibly important to decision making. And so that rush to get back to normal, as Jennifer talked about, was at the expense, at least in the short term right now, of fully absorbing where we're at. But that is, why sort of I think, the work that Sarah continues to do, marked by COVID's work to establish a national COVID memorial, extends beyond any one administration. We know it will take probably a decade to get ourselves there between building local and federal support. And we're committed to seeing that through. Because while we're experiencing this sort of, normal, quote unquote, period now, things are not normal. People feel weird. Whenever I talk to folks one-to-one in conversations, they kind of lower their voice and say, I think it's really weird that we're not talking about COVID and what happened. And I feel really lucky I didn't lose a loved one, but it was really hard. I was trying to juggle work and my kids and worried about losing my job. And those are stories that matter as well, because they have profound impacts on the decisions that we make and how we support one another during times of crisis.
Well, and I'm going to share more stories from our own colleagues here about their early memories of COVID. But before I do that, Sarah, I'm actually curious to hear, because we've gotten a lot of people who have written in about their experiences, and there seems to be a common thread of collective grief, collective loss, and collective experiences of the abrupt changes that was happening during that time. Sarah, can you share with us what was written in the journaling project? Did you find some common themes from people that were wanting to share their stories with you?
Absolutely. So, I think mentioned, we had all told more than 1,800 people around the world contribute at least once. Some people stuck with the project and some didn't. But the really extraordinary thing about the project is that I would have loved to start earlier, but it's hard to get a research project off the ground. And our team was really proud that we managed to do it in 8 weeks. But what we can see is the patterns, right? So if you think back to May 2020 and how terrified we were, how uncertain we were, we didn't understand how the disease was transmitted. We didn't understand how to protect ourselves. Many of us were wiping down our groceries. We were really in a state of uncertainty and confusion. And then the summer came. We saw the murder of George Floyd. We saw an incredible wave of social protest to come up very quickly. And suddenly it wasn't just the pandemic that we were thinking about, but we were thinking about profound inequities in our society at a time in which we were also dealing with the pandemic. Over time, if you think into the fall, at each stage, we saw elections, we saw wildfires on the West Coast. We saw the insurrection of January 6th. At every moment, people weren't just living through a pandemic or trying to live through a pandemic. We saw people living through all of the things that were happening around us. And in the journal entries, we see people talking in very concrete terms, sometimes very specific terms. Sometimes, it's really extraordinary. You can see in 3 sentences, people can tell you a whole story about who they are and what they're feeling and what they need, or how they feel betrayed, or where they find hope, even in a tiny little journal entry. And some people would write lots and lots. We also have lots of photographs that people contributed to capture aspects of their pandemic experiences. And we actually took a subset of those photographs and put them into an exhibition that's now traveled around the world. It's traveled to Hartford, Providence, Heidelberg, Germany, Mexico City, Toronto, and now it's up. If you happen to be around the University of Connecticut stores, it's up in the store's campus library till March 20th. And you can see some of the images that people took to capture what they lost, what they feared, what made them laugh, how they were managing that feeling of, some people talk about it as a Groundhog Day, kind of, the same day over and over again. So the journal entries give us so much perspective on those everyday realities and also the diversity of experiences. And this is something I think is really important. There are people who lost more than one relative. Mm-hmm. There are people who didn't lose anyone that they know. And the differences have everything to do with social power, with privilege, with how resources are distributed in our society, how different groups of people are represented, with racism, with ableism. So, and we have stories, we have first-person narratives that help us get a sense of that wide variety, which is also incredibly important for us to think about.
Well, even just asking colleagues here in the building, we have a wide variety of experiences. Where We Live producer Chloe Wynn has shared with us that I was living in Boston at the time and worked at a law firm downtown. I was considered an essential worker, weird. So I remember the massive shift of consistently being one of the only handful of people on the train going home every night. And our technical producer Dylan Reyes shared, I remember very vividly leaving both high school and my performing arts high school and joking, see you in 2 weeks. Most of those folks I never saw again since I graduated only a few months later. And so before we go to break, I do want to get to a couple of things here, and especially with the stories that we've been sharing, both from within and from your journaling project and from our listeners. Sarah, why do you think it's so hard for us to remember COVID and the pandemic?
Yeah, well, I mentioned the sort of repetitive, monotonous experience that a lot of people talked about in their journals. I think one thing is that there's a lot of people have spoken in their journals about the period of being a blur, undifferentiated time, that sort of where things flowed into each other and it's hard to remember what happened when. So I think that's part of it, that sense of things as a blur. And I think another key part of it, and I'm not a psychologist, I'm an anthropologist, but I think we are still, and this really connects with what Kristen's been sharing with us, we are struggling to understand the pain, the loss, We're struggling to mourn the ways in which our lives have changed in ways that we don't fully understand, and the ways in which the lives of people around us have changed, and the ways in which the structures of our society have changed in ways that are difficult to understand and that have influenced our politics and our political process and the shape of our country in profound ways.
And Kristen, would love to get your thoughts here too. Why do you think it's so hard for us to remember what had happened, what is still happening?
Yeah, and I'll just add to what Sarah has said. I think the other thing that comes to mind to me is that we didn't do that well when it comes to the pandemic response. If you look at the United States and sort of number of people who died versus sort of our countries around the world with similar economies, similar types of, Western societies, we performed worse than anybody else. And so the thing that I continue to come back to is that it's hard because it challenges American exceptionalism. We expect ourselves to always be the A+ students in the room, and we weren't in this case. And we saw, this huge kind of light shown on all of the stress test on our systems, and saw things break in front of our very eyes and the real world life consequences behind that. And that's a lot to swallow. I remember having a conversation with my mom shortly after my dad died, and seeing her realize for the very first time that the government may not have her best interest in mind shattered her entire world view. And it terrified me to see that fear on her face. And so that really has left a profound mark on me to kind of recognize some of these things that Sarah's pointing about how our country looks a little bit different than who we thought we were is different than who we are.
You've been listening to Kristen Urquiza, who's the co-founder of Marked by COVID, and Sarah Willen, who's the co-founder of the Pandemic Journaling Project. Let us know if you have a memory of COVID-19 that you would like to share with us. We want to hear from you, 888-720-9677, or leave us a comment on Facebook and Twitter at Where We Live. And earlier we have told you all about asking our colleagues about their earliest COVID-19 memories, and some of the memories were of the simplest tasks made complicated, like getting groceries, for example. Wheelhouse host Frankie Graziano shared with us that on March 11, 2020, he had 2 full BJ's carts and hundreds of dollars in groceries to feed the family for a few weeks. And then Megan Fitzgerald shared her memories of having an entire grocery store protocol, including wiping down groceries before bringing them into the house. This is Where We Live from Connecticut Public Radio. I'm Catherine Shen. Today marks 5 years since COVID-19 was declared a global pandemic. Before this broadcast, we touched base with Richard Gard. Before getting diagnosed with COVID in March 2020, Richard worked at the St. Thomas More Chapel at Yale and the Yale School of Music. He suffers from long COVID and reflected on his memories of being sick, what his life looks like today, and how it impacts his family.
The ones who still have trauma over it is actually my wife, who was there all the way until they realized it's that COVID, it's that coronavirus thing, and sent her and everybody out of the hospital. And now, even if I just go like this, like I'm going to scratch my chin, she has a pretty terrible reaction to it still, and still has PTSD. And then the depression of feeling trapped in my house, and still I really can't go outside if the temperature goes below, say, like 45, and I love the winter and cold, but rather than trying to picture it as something taken away, it made us so now we're down in the Caribbean. It's too hot for me, but I can breathe and my heart is very happy. I don't know, maybe it's a musician's attitude. The show must go on, really, because that's when you're up there, the show must go on. Just like the business that you're in. Once it's started, you smile and the show must go on.
Well, it's nice to hear from Richard, and the show will go on with Kristen Urquiza, who's the co-founder of Marked by COVID, and Sarah Willen, who's the co-founder of the Pandemic Journaling Project. So, Kristen, we've been talking about this project during this hour. What are the next steps for the Marked by COVID project?
That's great. You're asking. We've been doing exhibits at universities and cultural centers and museums across the country of our memorial. So we'll continue that over the course of this year and beyond, as well as talking to lawmakers to be able to start to introduce different bills to make this reality. As I mentioned a moment ago, we know it's a long-term project. This isn't going to happen overnight. We're setting ourselves up to be able to have something in the next 10 years.
And Sarah, you also have an event tonight through Zoom to commemorate COVID. Can you tell our listeners a little bit about it and where can they find more information?
Absolutely. So we decided that we wanted to do something for the community of people who've been involved in this project, which involves, again, folks around the world, researchers who've collaborated with us, our students, our families. So tonight at 6 p.m. Eastern Time, we're going to hold a community commemoration. It'll be about an hour and a half. And what we plan to do is give a quick overview of the Pandemic Journaling Project and how it came to be. We're going to hear from some folks who journaled with us, some really wonderful people who've been part of the project, sharing their experiences. We're going to learn a little bit more about the exhibition that I mentioned earlier, Picturing the Pandemic, which you can learn more about at picturingthepandemic.org. And we're also going to hear some brief reports from Kate Mason, my co-founder, from Heather Wirtz, who's worked with us as a postdoc, our colleague Andrea Flores, also at Brown University, and some other colleagues and students who've been part of some side projects we've done about the impact of the pandemic on first-generation college students, on Black women caregivers, on immigrant women in New York City. So we're going to give little snapshots of the research we've been doing. And we're going to invite people to give some more feedback and share a little bit of their experiences. So all are welcome to join us at 6 p.m. tonight. You can register. Easiest thing to do is look us up on Facebook, on Instagram, on Blue Sky, or on LinkedIn. If you hit us up at Pandemic Journaling Project, you'll find a way to click a link and register, and we would love to see you there.
Well, it sounds like you have all the grounds covered here. We got about a minute here, but would love to ask both of you, as we come to the end of this conversation, clearly something that will be ongoing, especially as you work on the journaling project continuously and also with the memorial. Are there ways to honor the past as we look into the future when we don't have a place that we can go to, or maybe we're not writers, or we don't want to hear our own voices recording audio for our project? What's your advice? Kristen, let's start with you.
Yeah, a great question. I think the thing that you can do is just take time, just take a minute, take 5 minutes in your day to be present, to breathe, to allow yourself to kind of feel what the sensations are in your body and kind of reflect upon, what you've experienced. And I think that centering is really a powerful way in which to move forward.
And Kristen, Sarah, about 20 seconds here.
I love your answer, Kristen. The other thing I would say, I'm an interviewer like you, Catherine. I would say find someone you care about and ask them how the pandemic has affected them and listen.
Well, that makes me feel a little bit better because I have been more intentional about meeting friends and family for coffee. So thanks for that last validation at the end of this conversation. I want to thank our guests today. You've been listening to Kristen Urquiza, who's the founder of Marked by COVID. Kristen, thank you so much for being with us today.
Thanks for having me.
And you were also listening to Sarah Willen, who's the co-founder of the Pandemic Journaling Project. Appreciate your time as well, Sarah.
It's really been an honor. Thank you.
I'm Catherine Shen. Today's show is produced by Tess Terrible. Our technical producer is Dylan Reyes. Download Where We Live anytime on your favorite podcast app. Thanks so much for listening and take care, everyone.